Module 3. Documentation Guidelines for MDM and Time.
When billing by medical decision-making, you'll need to document 3 key elements of your cognitive work: the problems addressed, data reviewed, and the risks assessed. Billing by time requires a face-to-face visit by a physician or qualified healthcare professional, performing and documenting any number of qualifying activities. Staff and residents' time do not count towards billable time. Regardless of which billing method you choose, you must always establish medical necessity and capture the essential documentation elements of an evaluation and management encounter, specific to the patient on the date of service. Determining the appropriate E&M level for the patient encounter involves selecting the appropriate level of medical decision-making for each of the 3 columns shown here. Understanding the qualifying criteria for minimal, low, moderate, and high MDM levels is obviously important. But mastering the documentation fundamentals of all 3 key elements is imperative for reimbursement. The first key element of billing by MDM is the number and complexity of the problems addressed on the date of service. Since documenting your medical decision-making is a cornerstone of clinical collaboration, you'll need to provide your colleagues with the context for why you're seeing the patient. Memorialize the nature of the presenting problems. Be sure to include all complications and risks that you're addressing. And be as specific as possible, including the trajectory of the patient's condition. The second key MDM element is the amount and/or complexity of data reviewed and analyzed. You should include your impressions and findings that support your diagnosis, evaluation, or treatment. Data may not be subject to analysis, but may be included in your clinical thought processes. Tests ordered during a patient visit are given credit for that encounter. Tests ordered outside of a visit may be given credit during the encounter in which they are analyzed. Separately billed services are not counted for the purposes of determining the level of MDM. The third key element of MDM asks you to assess and document the risk of complications from appropriate management and treatment options, which are distinct from the risk of the condition itself. You should provide your colleagues with a snapshot of your assessment based upon the nature, probability, and consequences of the patient management options under consideration, including those options you might choose not to pursue. Be sure to cover the categories of risk, including social determinants of health. When you document your medical decision-making, describe your assessment of morbidity and other risk factors to your colleagues. Scoring your medical decision-making and selecting the corresponding E&M level must be supported in the patient's medical record for the date of service. When choosing to bill by time, the documentation guidelines for evaluation and management encounters do not change. Establishing medical necessity and including essential elements in the patient's medical record for the date of service are necessary for quality patient care and optimal reimbursement. When using time to select E&M levels, keep these important guidelines in mind. Count practitioner time only. A unique time statement for the date of service is required. Billing by time requires a face-to-face visit, even though non-face-to-face activities are counted. Track the time for activities on the date of service only. Don't double count time if you are performing other billable procedures. Clinical documentation is a qualifying activity. When a prolonged encounter occurs, use the appropriate prolonged services code. Irrespective of how you choose to bill, patient documentation should reflect your cognitive work. Establish medical necessity and include the essential elements in your encounter note. If you focus on communicating what your colleagues need to know, patient care is improved, reimbursements are optimized, and compliance risks are reduced.